Okay, good morning, ma'am.
Good morning.
My name is Fitzmichael.
I am with Charity Ochoba,
Okay.
a dental practitioner currently working in one of the biggest hospitals in Malaysia.
And which hospital is that, ma'am?
St. Charles Borromeo Specialist Hospital, Malaysia.
Thank you for having you.
Thank you.
Welcome to Rigo Eye Foundation Africa.
Thank you.
By the grace of God, I am the operation manager. Today we really happy to have you around, and we see you have done with what really brought you to Rigo Eye Foundation today.
Okay. I was invited to come for an outreach. And outreach is about telling people, oral outreach, telling people about their oral health. So that was the reason I came, which has been fulfilled.
Okay, so have you attended to some people?
Yes.
What's your stake on the people you have attended to?
What? The main thing is letting them about their, like I said, letting them about their oral habits, what they should do and what they should not do. Because in our society today, some persons don't know what can cause teeth problems, and those who know that their mouth is gateway to their health.
Okay, and that.
So it is through this outreach that you tell them, look at this, so this. This is the cause, this is the preventive measure to take. This is what not to do. This is the right thing. People assume that when you do this thing to your teeth, that it will help you. But when a practitioner, as they see such case, it's left for him or her to tell you this is the right thing to do, which I think helps a lot in general well-being of the body.
Oh, thank you very much. If I should understand you very well, the purpose for outreach is to cut off or curtail self-medication and expose the communities with the right professional in health tips and on how to make healthy habits. That is, today I've been able to educate as many that come in contact with you on how to take good care of their mouth. You just mentioned something that's so enticing. You say the mouth is the gateway to the health or to the body. I really like that. Yeah. I want to, Rigo Eye Foundation is a community-based foundation. Our vision, our mission is to make sure that everyone has an access to quality good health and say no to all this self-medication and all this herbal stuff. That's the purpose. So having you here is an opportunity to make our viewers and our audience know some certain things. I'm supposed to ask you questions on professional or personal profession, but no, I want to go direct to community-based. Yes. You understand, community-based. Yes. And I have some questions documented here, which, as I'm talking about community-based, I want to ask you impact and community-based. We're talking about oral health now. Yes. That is, as a dentist, also. Yes. So I want to ask you question one. I just have only 3 small questions. Yes. How can people better prioritize dental care in their life? How can communities that are watching us, how can people that they don't know that this thing is happening, how can they better take care of their health, coming from a professional like you?
That is the reason in this profession we have this outreach. That is the only when you make an announcement, you gather people like we did today. Okay. You tell them the importance of this. Like there's a guy that came here. He was telling me that he don't know that dental treatment exists.
Wow.
I asked him, how would you come across hearing of a dentist before? So if you didn't do this outreach, how can he know? It is the main important one is this outreach. You let people know that even in dentistry there are branches of it. So it is left for you when you come to them, this is this one does this one does this. So that you let them know that self-medication is bad. It is only through outreach that they can be able to know.
Okay. I want to see throw more light on this question because I need some tips to our audience.
Okay.
Like when we do our interviews on professional outcome, this question, what I really want to know, okay, the question is how can people or community members better prioritize dental care in their life? Which way? What are the methods? What can they do? I don't know if you're understanding me. What things you are telling our audience now? Okay, we have started dental care in Eagle Eye Foundation, and today being the first day of this particular outreach. As I'm going, this is what I'm leaving for you people. This is what we'll be doing. This is what we'll be doing to better prioritize, because we think when you're feeling heavy, you just go and take paracetamol.
The first thing to do is to tell them that you have to be going on routine dental checkup every 6 months.
Okay.
That is it. When you come for routine dental checkup, that is the first step you take.
Okay.
Where they will examine your teeth, wash your teeth first. Then if there is any other teeth problem, you can now be referred further on what to do. But the main thing is telling them that it is necessary to visit dental clinics every 6 months, twice in a year.
Right. Is it any diets or activities that affect our teeth?
Yes.
And
there are many activities that affect it, even diets.
Okay.
Like when you come for this oral check-up, you'll be asked, how many times do you brush your teeth in a day? What type of toothbrush? How many times do you change your toothbrush? This is what we'll have to tell them, and the questions that we'll have to ask them. Okay, like some diets. It is necessary that after eating every meal, you have to floss your teeth. Flossing is very, very necessary. That remove those food debris in between the teeth. You have to rinse your mouth with water.
And do
That is rinsing of mouth. You have to rinse it with water, so that those food debris can also as well go out. Especially, in our lives though, we consume a lot of carbohydrates that sticks to the teeth. So with all this, you do it again. Some activities like you educate your patients or your audience that for some, how do I put it? Some treatment given to their children, like tongue sucking, can affect it. At times when you see some people, see their mouth cannot be helpful to cover very well. It's as a result of tongue sucking. Using of feeding bottle is not advisable. You can use spoon and feed your child. So that because you see when the child grows, he or she might be coming for braces to correct the tooth. So that is some of the aspects. And you educate your audience too that fruits, taking of fruits helps in maintaining oral health. So that is the activities that affect our health and the healthiness of a good teeth.
Okay, let me just ask this one, still on this question. You just mentioned you asked them how many times did you brush your teeth?
Yes.
So professionally or medically, how many times can one brush his or her teeth a day?
Professionally, you brush teeth last thing in the night. Compulsory, last thing in the night. Then in the morning, you wake up, you rinse with water. Then after eating your first meal, you brush again.
Wow, take notes, take notes.
Yes.
So when you brush last thing in the night, when you wake up, you just use water to rinse your mouth and then eat after eating brush, so that when you are going out, you have a good. That is my pattern. Thank you. That means I've been doing well.
Yeah.
That is my pattern.
Yes.
Okay. Thank you for that one. The last question, I say 3, but I want to minimize it. I'll just go to ask only 2, so that because of time. I want to ask, the body system, like in sociology they say, we call it the organism that have interconnection, the hand, the mouth, and in the medical field, they have been able to segment each department to be specialist on its own. Like today, we used to treat eye, but today we are treating teeth, which is still part of the body. I want to ask you, what role does dentistry play in the overall health?
That was, even if you can recall back, this is the first answer I gave in form of telling you, as in pointing out something. I told you that dentistry, the oral is in form of oral health. It's gateway to your health. When you don't take care of your mouth very well, it will affect other things. You contract diseases that will go to the entire body to harm it. Do you understand?
Yes.
So dentistry played the major role in the entire body. So when you take proper care of your teeth, you won't contract disease. So like people say, is it Anya baby, Email baby? Likewise, all no baby, so all no baby self. Other parts of the body will start.
That one means what?
They went, okay, sorry. Like, let me use, should I put the my understanding? When the mouth is crying, the eye will also be crying, ear will also be crying. So when you don't take care of your teeth, as you are feeling uncomfortable, doctor say, I want to, my teeth are can you be able to eat? You can be, when you do not eat, as you, will you feel okay? Your tummy will be rumbling, disturbing you too. Have you seen the impact of it? So
okay, finally, before we leave you, there are still audience trying to ask us how many times to change toothbrush. I thought of this question.
Okay.
How long?
Professionally,
how long will somebody
is meant to be changed every 3 months.
Every 3 months.
Yes.
Okay.
Every 3 months.
You throw it away.
Whether good or bad, you throw it away. Most especially when the bristles. The bristles is the outer part. Yes. Has been, as in, it's scattered. You need to change it. Or it's scattered because you see some people. You see the bristle of their brush is scattered. That when you use it, it will be damaging your gums. At times when you are brushing, you see blood coming out from your mouth, from your teeth. You see it. That is the one, as in the effect of that brush that is no more good again. So brush is meant to be changed every 3 months. Wow. And you will use brush according to, we have 3 brushes, that is soft, medium, and hard. Okay. So we use it according to the one that is good for you. We recommend it according to the one that is good for you. Thank you.
Okay, that means today we learn about some few things. We learn about brushing your mouth last thing before going to bed, or when you wake up, you just flush your mouth and eat before brushing again. And we understand that our mouth is the gateway. And very important, your brush should be changed every 3 months, whether good or bad. Thank you very much. We will be having you continuously to educating us on how to take good care of our gateway to our health. And I still remember my faith. Michael, you can call me Faith Assured.
Thank you.
Very important. Thank you, ma, for having you. Welcome once again.
You're welcome. Thank you.
Thank you.
Bye.
Here in Africa, shining bright through the storm.